Good morning. I will be discussing the chapter 9, which is evaluation strategies for the laboratory and clinical practice settings. And under this chapter, we have three subtopics. First is identifying the goals for evaluation, clarifying the students for evaluation, and lastly, selecting and applying evaluation methods. For my objectives, first, identify and understand the goals of evaluation. Second, state the purpose of evaluation and identify the different types of evaluation methods. For my introduction, evaluation is a set of techniques used to judge the effectiveness or quality of an event, improve its effectiveness, and inform decisions about its design, development, and implementation. Evaluation can occur before, during, and after an activity. It is important in healthcare because it supports an evidence based approach to practice delivery. It is used to assist in judging how well something is working. It can inform decisions about the effectiveness of a service and what changes could be considered to improve service delivery. Educators may feel overwhelmed by measuring how learners create personal meaning and demonstrate understanding of the consensually validated knowledge they will need to practice competently in their field of health. Measuring the efficacy of our own teaching in relation to preparing learners to practice safely, ethically, and in accordance with entry to practice competencies is not straightforward either. However, whether we are seeking to appraise student learning or our own teaching, knowing the criteria for expected outcomes will help us understand what is being measured. So for the learning cell, um, first, identifying the goals for evaluation, we have to assess the extent or the measure of system functionality. So, system functionality is the ability to perform a task or how efficient you are as a teacher. Second is to assess or effect of measure or result of interface on user. Ibig sabihin yung impact niya or yung link or connection niya. And third is to identify specific problems um, so that we can modify or change teaching strategies if needed. So there are two types of evaluation. First is the formative evaluation, or sometimes known as process evaluation. This type of evaluation addresses how well the individual or program is progressing towards a goal. Information acquired through formative evaluation is used to improve or enhance progress through feedback. It judges students' progress meeting desired outcomes and developing competencies for practice, and it occurs throughout instructional process and provides feedback for determining where further learning is needed. So basically, formative evaluation helps in making changes in the curriculum, teaching strategies, and learning environment. Second is the summative evaluation, which is a final form of evaluation conducted to determine if pre-established outcomes have been achieved. Most frequently used for final decision making, where end of the instruction evaluation to determine what the student has learned in classroom or clinical practice. It also judges quality of students' achievement in course, not progress of learner. So when planning for evaluation, many find it helpful to determine if their evaluation should emphasize formative or summative needs, and also to determine if the evaluation will be most useful if it focuses on individuals or the program or institution itself. So si summative evaluation, it is a cumulative assessment for the purpose of the selection, promotion, prediction, recording, or other administrative purposes. So students' progress and masteries are formally judged in this kind of evaluation. Next topic is clarifying the students for evaluation. So the first step is to clarify the objectives and goals of your initiative. So, what are the main things you want to accomplish, and how have you set out to accomplish them? Clarifying this will help you identify which major program components should be evaluated. So the nature of evaluation, so it deals with the final task of determining competency among learners. It is a continuous process, and observation plays an important role in the process of evaluation. And along with the intellectual development, it deals the physical, mental, social, and emotional and all-around development of learners. Next, the purpose of evaluation. Mainly, this is to motivate students to learn more as they discover their progress in given task. So, malaki ang participation ng isang teacher sa progress ng kanyang estudyante kasi we are the ones who motivates our students. Second, to encourage students to develop a sense of discipline and systematic study habits. To provide educational administrators with adequate information about the teacher's effectiveness and school needs. So, ang evaluation pala, hindi lang para sa student, para din to sa teacher. Kasi kung ano yung outcome ng evaluation mo sa iyong estudyante is outcome din na kung paano mo turuan yung estudyante mo. And lastly, to identify the problems that might hinder or prevent the achievement of learners. And last topic is selecting and applying evaluation methods. First is observation. So observation is a method by which an individual gather first-hand data on the interventions, processes, or behavior being studied. It can be used at any stage of the evaluation process. So threats to validity and reliability. So teachers' values and biases may influence what is observed. So meron kasi dyan, in over-reliance on first impressions. Siyempre, kunyari si Juan, estudyante mo sa RLE. Ayan, si Juan magaling. Pwedeng pakawalan. Madaling mag-pick up, madaling matuto. Tapos, naging estudyante mo din siya sa lecture. So, dahil nakita mo na si Juan ay magaling sa RLE, so ang first impression mo, ang iisipin mo, magaling din siya sa lecture. So, hindi po ganon. Meron po mga bata na or may mga students na magaling sa RLE pero hindi naman magaling sa lecture. May magaling sa lecture pero hindi naman magaling sa RLE. So it differs. It should observe over time and in different situation before drawing a conclusion. Pagmasdan mo muna, wag kang judgmental. Ganun. It focus on observation may differ with each instructor and time period. So, teacher may take incorrect judgment about the observation. So, kapag ikaw ay may na-observe kay student, better kung i-discuss mo sa kanya kung ano yung mga na-observe mo para naman magkaroon siya ng ma-modify niya yung kanyang mga ginagawa or actions. Even observation in clinical setting is only a sample of the student's performance. And observation of the same student at another time may reveal a different level of performance. Same is true for observation of teachers' performance. Next is written work. So, ang use nito is to assess problem solving, higher level thinking, understanding context relevant to clinical practice. Misuse is student complete the same assignment repeatedly throughout a course after outcomes have been met. So, maganda lang siya sa umpisa because you get to know or you get to assess the student's knowledge and capacity to new situations. Pero, kung paulit-ulit na ganun pinapagawa, like for example, NCP, hindi mo na talaga ma-assess yung ibang areas that needs further assessment and evaluation. Next is simulation. These are the activities that allows learners to experience a clinical situation that risks and constraints of a real-life situation. it does not replace the actual experiences with patients. Kasi nga simulation lang siya. It is useful for clinical evaluation as well as instructions. So the uses of simulation for clinical evaluation, it cases scenarios that students analyze. Um, Computer simulations, models, and mannequins, standardized patients, and human patient simulators. Siguro, while best ito, while nandito tayo sa ganitong sitwasyon, which is pandemic, where our students cannot perform actual duties in the hospital. So, uh, simulation na lang. Next is self-evaluation. This is the ability of the student to evaluate their own clinical competencies and identify need for further learning. This is difficult for some students to assess their own performance, and it is appropriate only for formative evaluation. So, when you self-assess kasi, you become an active participant in your own evaluation. Your involvement enables you to honestly assess your strengths and also the areas where you need to improve. That's all po. Thank you.